Good morning, Illini. Welcome back to another Healthy Illini podcast. I am your host, Matt Schrock, and it is time for the fall 23 semester to begin, which is kind of crazy to think about because I'm still getting used to the fact we're in 2023. But we're excited to have students back on campus. We're excited to see all the energy and the excitement there. But there's some things that are happening around McKinley and around campus that are exciting as well. And we want to share a little bit about that. So hope you're listening in to find out about some new opportunities that you have in your health and well-being, and I've got some people here to talk about it, so we're going to jump right into it. McKinley is your health center for UIUC students, but we have tried to expand that program just a little bit and give some opportunity for accessibility and things like that. And so we're talking about that today with a new program that's rolling out. But I want to introduce my guests first. Have a couple of our staff here from McKinley Health Center. First up is Melvin Fenner. He is the Senior Assistant Director of Medical Systems and Compliance. He works for McKinley, but also works for Student Affairs Technology. Technically, don't ask me to explain how because I have no idea, but we're glad he's here. Mel, I'm glad to have you here on the program.
Thank you. Always a pleasure to join you all and talk about some great things that we're doing.
We're also joined by our pharmacy supervisor, Brian Aubrey. As I said, he oversees the pharmacy here at McKinley, but is also involved in a number of other things around campus. Brian, thanks for joining us.
Yeah, thank you. Thanks, Matt.
And healthcare, higher education, but is also, but healthcare is a field that is constantly going through innovation and progress. And that was kind of pushed to the forefront with the COVID shutdowns and needing Zoom calls and meetings and telehealth and things like that. I've seen it throughout my 8 years here at McKinley. Some are more noticeable to the public, like telehealth or the patient accessible portals that we've started using, the My McKinley portal. But some are behind the scenes, like improvement to health records, equipment, things like that, just tools that we can use to better serve our students. But in the past few years, we really branched out into something that was fairly unique in the idea when we started with it. And it's still pretty unique in that trying to find people that can facilitate what we want to do. But that's having a vending machine on campus. And so for a few years, we've had a vending machine at SDRP, which is over Eikenberry Commons. And we're going to expand that program. And now we're calling them McKinley Self-Care Stations. So if you hear McKinley Self-Care Station, we're talking about the vending machines. We're talking about what was HRC in the building and elsewhere on campus. But let's start off with going back a little bit and to the first vending machine that we had. Could you share a little bit about what that was and kind of how it functioned?
Yeah, so I think it was 2020. Mel and I were looking at satellite options for Dr. Parker, and some of those options were like the self-dispensing machines that would actually give you prescriptions and lockers. And obviously we looked at a vending machine option. And so it was kind of decided that the vending machine was the most affordable of the options. And so we kind of went that route as a kind of a test case to see how that would work on campus. And so the results that we got from how it's been functioning at over SDRP are very good. So students are very happy with the products that they can get there.
That program started, I was going to say at SDRP, we're going to talk about that. But what does it mean to have a vending machine for healthcare? What is that even? I mean, when you think vending machines, you think food, you think soda, you know all these types of things. But vending machines can do a lot of different things. How did that function at SDRP? How did that start?
Yeah, so we primarily, you can't put prescriptions in vending machines, so we primarily did the over-the-counter stuff. And the kind of the general idea was self-care. Like if you need ibuprofen to get you through the night, then you could go to the vending machine and get ibuprofen. And so we're kind of looking at self-care. We're expanding right now to increase access. When we first set up SDRP, it was McKinley's on the, southeast side of the campus. We have something in the Union, kind of in the middle, a resource room there. And then so STRP was kind of on the other side of campus. So we kind of triangulated that. So
one of the double-edged sword of that is that it was very popular. We know that. We've seen the data. We've seen the usage of it. But it was very popular with students who were in Eikenberry. there are a lot of students, as we started to do some polling and some surveys and some outreach and asking about it, there were a lot of students that had no idea there was a vending machine in Eikenberry because they never went to Eikenberry. Especially you start talking like graduate students or students who live on the north side of campus in apartments or housing there. They may not have had any idea we were there. We were at one point we were talking to students that were in the Arc, which is just across the street, and there were a number of them like, oh, really, you have a vending machine? It had been there for a couple of years at that point. And so that's when the conversation really started to roll, that not only is this a viable program, but we see the need other places. And so with this new expansion, where else are we talking like another vending machine, 10 vending machines, a vending machine for every student? What are we talking about here for the rest of campus when we start talking about an expansion rollout? Where can students expect to see these machines?
Yeah, so we kind of looked at the campus and we were looking for access to. So we wanted to get places that students were able to get in extended access. So right now we're going to expand. We're going to put one in the ASIS library. We're going to replace the one in the STRP because we are replacing these with touchscreens, and hopefully that will provide a little more information. Previously, the one in STRP was just you look in there and you pick what you see kind of thing, like you would see for candy bars and gum and stuff like that. But right now we're going to have a touchscreen, which will have a little logic on it to help point you to different products for different situations. So STRP would be the replaced. We would have one at the Illini Union, and we would have one at Granger Library. And so we felt that those locations right down the middle, most of them would give the most students the most access. And as far as time opening, I think Granger's close to 24 hours. I'm not sure, but that would give the most hours.
You mentioned logic. Mel, I'm going to kind of turn to you on this one because you both talk about logic and vending machines, and you know exactly what you're talking about. Anyone else is like, what does logic mean? I have no idea what that even implies. Yeah. So with these new machines and touchscreens, I know there's a lot of exciting opportunities with that. Mel, would you kind of address what that means and what it means right now and what it could mean for the future?
Yeah, so students have always been limited on what they can obtain just based on quota, right? Maybe certain items only twice a semester or something like that. And so we've always had a program sort of behind the scenes, an application behind the scenes that can help manage that. And now with these smarter vending machines, I like to call them our new smart vending machines because they have big touch screens on them, like Brian said. And we have better ways to control the permissions that students have to access to certain medications that are inside of it. And so now that we have, we'll use a technical term here, we have API access. So for any of our more tech-savvy listeners, we have a set of APIs that we can use that essentially just allow us to tap into the inner workings of the vending machines. We can make it a little more complicated. Maybe instead of completely limiting somebody, maybe offer them the opportunity to purchase something if they absolutely need it. And so those are some of the things that, we'll be able to do now that we have a little bit better control over them. And because the machines are not your typical, snack machine, if you will, it has a lot more advanced capabilities to it.
Yeah. So when you walk up to the machine, we're able to program some combinations. So like a cold, kind of like you get with a cold pack. And so you would select on the cold products, and it would say for pain or fever, you would use ibuprofen or Tylenol. And because we're looking also at sustainability, in the past we would just give them a cold pack which had everything in it. Well, somebody might already have ibuprofen at home. And so the vending machine will allow you to actually skip. So you'll select your cold product. It says ibuprofen or acetaminophen or Tylenol. And you say, no, thanks, I already have it. And then it moves on to whether you need a thermometer, whether you need a COVID test kit, which are going to be in the machines also. So it kind of walks you through a little bit of a workflow or a logic to kind of point out things, and you can skip it if you already have it. That's kind of what we want. We don't want a bunch of stuff that you're going to take home and then throw it away at the end of the year. So we want you to pick up stuff that you're going to use and in the time frame. And if not, that's why that's why we've increased the access. So if you don't need it now, you can come back in a month or something like that. So,
and it does give that an opportunity for, I'm going to call it a personalized experience, because you can choose what's good for you, which one, anytime you get a personalized experience, I don't care if you're how jaded you are, it feels nice when it's geared towards you. The other thing is, like you said, it helps with you on the back end. As I know, Brian, you're the one who often goes out and refills the machines, that you're not refilling things that were taken unnecessarily. But real quick, because again, there may be a lot of people listening that aren't familiar with this. When you talk over the counter, when you talk with the most popular, the most used, let's say, most used items from SDRP, what are the things that you found that students most commonly access that other students might not know were available?
So we are adding the vending machine at SDRP, primarily had like ibuprofen, Tylenol, things that you could also get at the resource room. But the pharmacy itself has always had things like Plan B, pregnancy kits, things like that. We are able to add those to the vending machine now, because of the new controls that allow us to make emergency contraception available once a semester at no charge, or other items. We're able to add things that cost a little bit more because we're able to limit them a little bit better.
One of the questions we often get is, when we talk about the machines, is how do we get them? So Mel, what's the process when somebody walks up? I mean, do they have to punch in a code for themselves? Do they have to sign something? How do they access the machines?
Yeah, so now when they walk up to it, as Brian said, you choose the items that you want and add them to your cart, so to speak. And when you get ready to make your I don't want to use the term purchase because they're technically not paying for it, but when you get ready to receive those items, you can swipe your ID card, or the preferred way is actually to scan the QR code in the Illinois app. So within the Illinois app, there is what's called the Illini ID, which is sort of a digital version of the iCard. And you can scan that. The system will check to see what your eligibility is and then release those items that you're eligible for. And if you're not, it'll even give you a message that says, these items you're not eligible for. Here's when you would be, maybe you've you try to get too many items of something that you're not eligible for anymore. But as of today, using your iCard or using the QR code, your Illini ID in the Illinois app, those are two ways that you can get those things released. So we've got some future things that we hope to also tie into the app whenever, we can talk about that.
I was going to ask, because you did bring up the Illinois app, and I know there's a huge emphasis on campus to use that app in various ways. Not, every unit on campus, every college, every part of campus is looking for ways to integrate with the Illinois app to give that not only a streamlined access, but also to collaborate across units. And so are there things that are already in the app that are engaging with the vending machine, or is it stuff that you're looking to hopefully get to?
Stuff that we're looking to get to. I mean, we could do an entire podcast just on the Illinois app, because it has so many features that students, even faculty and staff, are just completely unaware of. We're constantly releasing new tools, and there'll be more things released later this fall as well. But future goals is that using the health screener that's already in the app. So right now, if you're not feeling well, you can go to the wellness section in the app, use the health screener to kind of understand your symptoms and get some suggestions of next steps. Our goal is, once you fill that out, if we suggest that you get a Colovac or some type of over-the-counter medicine that Brian has available in the vending machine, then we hope that we can point you to the nearest machine that has the inventory of the items that we suggest for you. That way, you're not walking around campus, going to each machine, trying to figure out who has the Tylenol, right? I mean, the last thing we want to do is not feel well and have to walk 5 or 6 miles to get the thing that we told you should get, right?
Right.
So, we really want to kind of have what I would call sort of a red box mentality. And I don't even know if red box is still a thing. I feel like it came and went.
I still use Redbox.
Okay, so Redbox is still out there. But when you're looking for a movie, right, it tells you which Redbox in the area has that, So we want to kind of get that type of functionality in the Illinois app. Once you've taken the screener and we suggest something, then we'd show you where is it on campus, and you can go in there and pick up that item at the nearest vending machine.
Yeah, because you're right. I mean, it's frustrating enough to go get something and you find out the location, whether it be like a restaurant or a library or a red box or whatever it may be, or a store, and you go to it and you find out they don't have the item that you thought they had. And then it's even worse when you're sick. When you're not feeling well, that's even more frustrating. And so I know that's something that's being looked at and is exciting in my mind, because it is that's a huge benefit for our entire student body, because these vending machines are serving all 50,000 plus, and that's a huge number of clients basically. And so I know that there's discussion about rolling out these new ones and then hopefully having maybe even more locations coming soon, that kind of thing. Is there anything else anything else that you're looking at? Not promising that it's coming, but just kind of things to kind of spark the imagination that are coming with idea of vending machines and how they could be used on campus in the future.
Well, one other thing that we could potentially consider in the app is not only showing you where the inventory is, but also letting you know what else you're eligible for, right? So if you've already received your allotment of a particular item and you think maybe you need more of it, why not be showing that right there in the app, and instead of, again, going to a location, even if they have it, and then just to see the message that, oh, sorry, you've already reached your allotment. So pulling all that together, Brian and I always talk about how do we pull together the information. We did that in the past with the pharmacy refill application, which is in the patient portal. Really just pulling that information together for students so that they can see it all in one screen, sort of at that digital front door approach. But I know, at the beginning of this conversation, Brian was talking about, we looked at different options, vending machines, lockers and things like that. I would hope that maybe lockers are still on the table for the future. Think about like the Amazon lockers or the UPS lockers that you see around town, where, somebody's putting your stuff in there and then you can go pick it up at your earliest convenience, so that students could then receive those medications somewhere else on campus. But, again, pie in the sky ideas, and Brian will have to help me, come back down to reality.
No.
It's like, let's go do it.
Well, we looked at we got included in the robot. You remember that?
Yeah.
Delivery, but there wasn't enough. It had to be food service driven. There wasn't enough volume for prescription delivery. But we were looking at it. We were in on the talks on a robot that would deliver your medications to your spot.
Which is amazing to me, because again, at the beginning I talked about innovation, and when I started here, it's only been 8 years, which in the life of a college student seems like forever, but it hasn't been that long. But like these conversations, vending machine, robots, would not even fathomable whenever I first started, and so it's really exciting to see the developments that are happening and being implemented. Because you talk about some of these things that aren't coming yet, but you hope to. The vending machine came about quickly. And then when we started looking at this, these changes and these upgrades happened fairly quickly, and comparatively. And so I'm really excited to see what's coming next. I'm excited to give this opportunity for you both to share the new developments with the vending machines on campus this fall, because I think it's going to be a massive benefit to our students immediately, and just help have better coverage for us to better serve students so they can better manage their health and well-being.
Absolutely. I mean, it's a large campus, and so we gotta, be out there, be closer to where the students are, meet their needs where they are, give them what they need when they need it, and so this is a huge convenience. Hopefully the students appreciate that.
Well, I know that right now you're both are losing your minds trying to keep track of everything, get it all up and running and ready to go. And you've put up so much work behind the scenes. And so I do want to say thank you publicly to both of you for this. But I really do appreciate you taking the time to talk with us today and kind of share about the self-care stations and what's coming.
Absolutely. Yeah. As always, I mean, it's always a big team of people behind us. We're sitting here talking to you about what's going on, but, we feel without acknowledging that we both have teams of folks that are, really also sweating bullets like we are trying to get all this stuff in place. So,
yeah, we have a great team here that really, I'm continually impressed by the passion and the skill of who we have in serving the students at UIUC. But thanks for coming in today, guys.
Yeah, thank you.
Thank you.
As a new semester hits us, we're chasing it full steam ahead already, and there's so many things going on. Some are familiar and some are not so familiar. And one of those is the self-care stations and the expansion here on campus. And if you have questions about that, you're not sure where to find one, you're not sure what it means, or you just want to give some feedback on it, we'd love to hear from you here at Healthy Illini. We'd love to hear from you at McKinley. Let us know what your thoughts are on it. If you have suggestions on ways it could be improved, you never know. It may be something that sparks an imagination or reminds us of something that we needed to take care of. And so please give us your feedback. We'd love to hear from you. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.